What is ZD or ZD? It's an extruded diet. What does that mean? Really tiny molecules. What do you think that means? Absorbed very quickly. What do you think that means? High insulin levels. They was using the diet to treat the dog's itch, and it's a very popular diet. The idea is, well, if the molecules are super small, then they won't irritate the immune system and cause a food allergy. Okay, but it is good to get your veterinarian on board with this so they can help you pick some of the other alternatives. Meanwhile, let's just show you a few cases to kind of give you an image of what happens. So this is Sensei, a 12-year-old female spayed Bichon Shih Tzu cross, which I wonder, does that mean it's a Schitzon? But at any rate, chief complaint, obviously, pituitary dependent hyperadrenocorticism. How do they know? They finally got their positive ACTH stimulation test. Everyone's all happy, apparently including Sensei, about the positive test because that opens the door to using drugs. So they went ahead and the dog also happened to be on ZD or ZD if you're in England. What is ZD or ZD? It's an extruded diet. What does that mean? Really tiny molecules. What do you think that means? Absorbed very quickly. What do you think that means? High insulin levels. They was using the diet to treat the dog's itch, and it's a very popular diet. The idea is, well, if the molecules are super small, then they won't irritate the immune system and cause a food allergy. So that's the rationale for the diet. But what it did instead is it gave Sensei Cushing's disease, at least from this model, I think it did. So what were Sensei's Cushing symptoms? Maybe you've seen these in your own dog. Thinning hair over the dorsum, alkaline phosphatase, a liver enzyme going up by 5 or 6 times normal, high fat, high cholesterol floating around in the bloodstream. So the treatment for the itch was causing the adrenal tumor. So what do? We just said, get rid of the ZD. Let's go ahead and put this dog on an anti-inflammatory diet, which, of course, also treats Cushing's. It corrects the dog's metabolism. A lot of you have inflamed animals that are inflamed because of their metabolism. It has nothing to do with their immune system. They just overreact. They're just an excessive inflammatory response to something that should have been relatively innocuous. So we go ahead and put the dog on essentially a paleo diet, raw meat and vegetables, with some antioxidants and fiber thrown in there. The 4 marbles combination for a dog that size. We were using about 1/2 of a teaspoon per 5 kilos of body weight. No drugs. And what happened after 2 months is a typical rate of improvement. The thinning of the coat's going away, and the itch has gone down because insulin was driving the itch, the inflammation tendencies, as well as the Cushing's. Alk phos levels had reduced by 2/3. By 5 months, they did another ACTH stimulation test because Sensei was doing so fabulously, and now you can't show the dog has Cushing's anymore. That means she did have big puffy adrenal glands, and now they're all small and normal sized again, which means you cured the problem. So the only lingering thing that Sensei had was a little bit of lipemia in the blood sample, which is common, but her liver was now normal, her cholesterol levels were now normal. A 1-year follow-up, same deal. So Sensei just had no more problems. Let's look at another case real quick. Carmela, a 10-year-old female spayed Shih Tzu. Not that this only happens to Shih Tzus. I don't want you to get that impression. Chief complaint, suspected Cushing's, of course. Similar idea, increased alk phos, 5 times normal again, and ALT, another liver enzyme. Previously, they were even higher, but by the time that we got to see this dog back in 2017, we'd already introduced just a raw diet, just on talking to the owner, when she called to get some initial advice for her dog. And so the liver enzymes did improve significantly, but then they plateaued. They aren't getting any lower. We went ahead and started the Simyasan just on the strength of the existing response to the food, knowing we needed to take it further, which of course is what we use the herbs for, and those super high liver enzymes, which really are pretty indirect evidence of Cushing's. We did the ultrasound, and the ultrasound showed the enlarged adrenal glands. That was twice as large on one side, and the large liver that tends to go along with this. So we kind of had our confirmation there. We went ahead and just continued on with the Simyasan and with the diet change and said, let's just stay the course, see what happens. And the addition of the herbs and the continued diet was all that was needed to bring the liver down to size, to lower the liver enzymes to normal, and therefore, of course, to shrink the adrenal gland down to normal. So these things just go away when, for the most part, when you use herbs and diet change. It's all very non-dramatic. I used to joke about how when I just did regular medicine and I would use drugs and I'd use surgery, I would create all sorts of problems and then I'd somehow get us through that. And boy, at Christmas time, I would get all sorts of presents because I would have taken so many animals back from the brink of death. Of course, I put them there with my treatments or my diets. And then when you do holistic medicine, then things just quietly get better. It's very rewarding as a veterinarian, but you don't get anywhere near as much in the way of Christmas presents. So it's I just have to put up with that. Anyway, what about your dog? Because that's why you're listening, right? So start by changing the diet. It's the single most important thing you can do. The herbs don't work very well if you don't change the diet. You can't fight the headwinds from that diet. What's the diet need to look like? A homemade meat and vegetable diet will do just fine. There's probably 1 billion recipes out there, lots of experts who will provide you recipes. We adapted ours from the Manual of Natural Veterinary Medicine, which you can find online. And there's an appendix in there that talks about the Paleolithic diet, and we just adapted that. Then we have a handout in our clinic and provide that to owners so they can make their own food. Otherwise, go out and buy one of those commercial raw diets. They're sitting there in freezers probably in your pet supply store freezers. So just go ahead and get those. If you need local vets to help you and you just don't think your conventional vet's going to be on board with this, I've listed a couple of websites there to find veterinarians in your country, in your state, in your city. Certainly the ones at CIVT will be familiar with what we have just talked about. The IVIS veterinarians, maybe not, but they'll be open to it, which is, of course, is what you're looking for. But if you don't have any holistic vets in your area, once you go and check those websites out, I did also put a copy of this presentation and a copy of an article that goes with it that you can show to your conventional vets to see if you can get them on board with just making the diet shift, getting the herbs in for you, and helping you monitor. You see these dogs, we checked again, right? We did the tests again. We checked their livers again. We do repeat ultrasounds. You need a health professional there to make sure you're not deluding yourself and that your dog really is getting better. So trying to find someone to help you is a really good move. You can find Simyasan online, yes. But it's nice to have that veterinarian involved to make sure that, again, the animal really is getting better. And like I said, you're not just masking something. And to help you manage the drugs, because a lot of you probably already using drugs for your dogs. And so you might be uncomfortable adjusting the drug doses on your own, as you should be. And so having a veterinarian involved to kind of help guide you through that process, because for most of you, you will need to lower those drug doses if you get these other components